Ladies and gentlemen, our topic today is increased expression of calcium-activated chloride channels on the smooth muscle in metabolic syndrome-induced overactive bladder and underactive bladder in rats. In this study, our aims was to investigate the differences in functional expression of calcium-activated chloride channel (CaCCs) on bladder smooth muscle tissue among normal and metabolic syndrome (METs) induced overactive bladder (OAB) and underactive bladder (UAB) rats. We used fructose-feeding rats (FFR), which were fed a fructose-rich diet while control animals received standard rat chow for 6 months. Then continuous infusion cystometry (CMG) was performed to record the basal pressure, maximum bladder voiding pressure, MBVP, intercontraction interval (ICI), and episodes of spontaneous contraction. After CMG was performed, FFR were categorized into 3 groups: normal detrusor function, NDF group, OAB group, and UAB group. Before CMG was performed, we collected the urine samples to detect urinary nerve growth factor, NGF, and brain-derived neurotrophic factor, BDNF. And after performing CMG, the bladder smooth muscle tissue were harvested for protein and mRNA expressions of ClCA4 and ANO1 chloride channels using Western blot analysis and reverse transcription polymerase chain reaction, RT-PCR. Finally, the CMG parameters, urinary NGF and BDNF level, molecular expressions of CaCCs, were compared between rats in control, NDF, OAB, and UAB groups. Move on to our result. The body weight, bladder weight, serum glucose, insulin levels, and insulin resistance increased significantly in FFR rats, proving the status of METs. Among them, the serum glucose level and insulin resistance increased most in UAB group. These slides show the characteristics CMG graph in control, NDF, OAB, and UAB groups. And this one is a comparison of the 4 CMG parameters between the 4 groups. When compared with control group, both urine NGF and BDNF levels increased significantly in OAB and UAB groups. However, the increases were significantly higher in OAB than in the UAB groups. Western blot analysis showed significantly increased expression of ClCA4 and ANO1 proteins on rat bladder smooth muscle in OAB and UAB groups. Also, the increases were significantly higher in OAB than in the UAB group. Quantitative RT-PCR analysis demonstrated significantly increased expression of the mRNA for ClCA4 and ANO1 in OAB and UAB groups. So we can get the conclusion that the changes of body weight, bladder weight, serum glucose, insulin level, and insulin resistance show the effectiveness of FFR on induction of METs in rats. And we can also see that the significant increase of serum glucose level and the highest increase of insulin resistance in UAB group indicate UAB group may represent the most severe condition of METs. Furthermore, we can get another conclusion that in OAB group, the urine NGF and BDNF level were highest among all groups, while in UAB group, the level were lower than OAB, but still higher than control group. Last but not least, the changes of expressions of ClCA4 and ANO1 chloride channel proteins and mRNA were parallel to those of urine NGF and BDNF levels, demonstrating the role of CaCCs on evolution of different stages of bladder pathology caused by METs. Thanks you for your attention.